I'm now in conversation with Dr. Emilio Manno, who's talking to me from Naples. He's one of the speakers at the Cambridge Healthcare Training TalkSurgery MasterClasses. And so I'm going to find out a little bit about him, his career, and also what delegates can expect from his masterclass. So, Emilio, just tell me a little bit about the Cardarelli Hospital and the work that you do there.
Okay. Cardarelli Hospital is one of the largest hospitals in Italy. It's surely the large hospital in terms of bed in the south of Italy. We cover all specialties. I am the chief of Bariatric and Metabolic unit, and I'm consultant of upper GA tract in this hospital from 2000. And we started bariatric surgery around 2000. I started my career in gastric cancer. It was my first field, but we noted that most bariatric patients came in our emergency for complication. So my chief of the department passed me to organize a service of bariatric and metabolic surgery. So we start in the 1998 with a 6-month training around the Italy and Europe too, to understand what means bariatric surgery. And then we start with a few cases, but in the last, because of a large demand of this type of surgery, we reached 60, 70 cases per year. Now we operate more or less 300 to 350 patients per year, and we cover all aspects of the obesity, the medical aspect, the psychological aspect, and the surgery. We are a center of excellence for the National Society of Obesity, and we are a referee center, a regional referee center for the weight regain surgery for people who had a first procedure and then regain, and for complication, because we have a gastroenterological staff very skilled in treat patients with complication, post-operative complication.
And how did you get into the medical profession in the first place? Did you always want to be a doctor or a surgeon, or what was it that led you into the profession?
Well, I decided to become a surgeon first. When I remember that when the family asked me what we're gonna do when you are 18, my answer was I want to be a surgeon, not want to be a doctor. So the surgery for me, it's always been my goal. I started my university in Naples, and I got the first fellow in the National Cancer Institute, and my field, it's ever been upper GA tract. So after 2 years, I moved in the Cardarelli Hospital, and until 1998, I for most of the cases I treated per year was a cancer, gastric cancer, and benign gastroesophageal disease like hiatal hernia and other disease, until the department chose me to found a center for bariatric surgery.
Oh, that's interesting. I'm just intrigued as to why it was when you were that young you wanted to be a surgeon. Was it because you saw a television program, or did you have someone in the family who was in the profession?
So I was fascinating from the anatomic atlas we used. My husband, who studied to become a doctor, and I saw for most of the time these books of anatomy, and they fascinating me more than the Popeye booklet or Mickey Mouse booklet.
Yeah.
But Dr. Kildare series did the rest. And
Ah,
I
okay.
did was one, I saw every films that at that time the Italian TV edited, and so it was a natural choice. Finished high school to start medicine college.
Yes, I remember the Dr. Kildare series. I used to watch those myself. And you talking about the anatomical books
Mm.
reminds me that my parents, when they bought me one Christmas present, it was something called the Invisible Man. And it was a plastic model with all of the intestines and the internal organs that
Yes,
you could see through. So
yeah,
you could put that together and understand where
I've had it.
oh, you had that one as well. Okay, so yes, so bariatric surgery. You say that that started in 1998. Was it something that was very, very new in those days?
You mean news about
Well,
bariatric surgery?
yes. Was bariatric surgery a new discipline? Something that
Relative, relative news. We had a boom with the laparoscopic surgery because before the 1990, the procedure was in laparotomy. But with the advent of the laparoscopy, we assisted a great sharing of the procedure all around the world, because the obese, it's it's more simple to treat obese patients in laparoscopy more than in laparotomy. And we can say that it's from 1990 that bariatric surgery became a proper discipline and in general surgery. And it's at that time that the first dedicated team grew up. Until now, and we can see that probably bariatric surgery in terms of number is the most performed surgery all over the world.
yes, I have a personal friend from my theatre group who had bariatric surgery because of her obesity, and it did improve her weight situation for quite a while. And she did supplement that with some exercises, and she really was transformed. But now, sadly, she seems to have reverted back to being obese again. Is this a typical kind of progress that patients make? Because I can understand that it's not simply a medical problem. Very often, it's also a psychological problem, as you indicated.
Yes, it's a social problem, first of all.
Mm.
People must say that obesity is a disease, like lung disease for the smoker, like hepatic disease for drinker. obesity is the result of it, like is alcohol can cause cirrhosis, smoke can cause lung cancer or lung disease. Too much too much food can cause obesity. There's no difference. This is the first problem that people must realize, but not the people, but the patients itself. Because one of the most important things that I stressed my patients is that you are you are you are a disease. Your disease is called obesity. You are not too much fat. You are obesity. Obesity is a multifactorial disease that afflict cancer, that afflict lungs, that afflict cardiovascular system, that afflict metabolical and pancreas. Most of the obesity patients, the obese patients, suffer from diabetes. Most of these patients had colon cancer, ovarian cancer, that is strictly linked to the obesity. So when we talk about obesity, we talk about a multifactorial disease that causes more death than starving cause.
Yes, I do commend you for the fact that you are looking at a solution, not just from the surgical perspective, but also from the patient psychology and understanding lifestyle and how to get people to change their behavior. So I'm really looking forward to your masterclass, which brings me round to asking you the question, what are you going to cover in your masterclass, and what can delegates expect to gain from joining you?
So the masterclass is focused on the sleeve gastrectomy, that is the most performed procedure in bariatric surgery. And the problem is that the many general surgeons start bariatric surgery without adequate training. These often cause problems in terms of complication. In the masterclass, it will explain how to minimize the risk of complication, starting from a correct indication. Bariatric surgeons often say that a longitudinal gastrectomy is a simple procedure. A good sleeve gastrectomy is not. And for these, little clips, video clips will be showed in order to show how are the tricks and tips to perform a correct sleeve gastrectomy. And another important aspect is complication, because a general surgeon of a young surgeon who start bariatric surgery with sleeve gastrectomy often doesn't recognize complication in time. So we can show and we can learn how to discover in time a complication, how to treat a bleeding, a leakage, because the clinic in obese patients is quite different from the normal BMI patients. And there's a lot of sign that probably you want to find, but you never find in obese patients. The abdomen of obese patient could be normal, but these patients could be severe peritonitis, for example. And I think that is a good opportunity for all young surgeons who intend to start bariatric surgery.
Okay, I think that's a very worthwhile masterclass, and I'm looking forward to joining you in that session and to publishing this video interview of you. I'm sure it will inspire and encourage people who are interested in bariatric surgery to join you at the end of September.